Dr. Pinsky, what triggered your interest in pediatrics?
Even before going to medical school, for some reason I had an interest in pediatrics. My first semester in medical school, in our community medicine rotation, I was assigned to a pediatrician in practice in St. Louis who had an interest in pediatric cardiology. I saw that he had great empathy, he communicated well with the families, and he would also participate in the pediatric cardiology clinic at Cardinal Glennon Hospital, the pediatric hospital. So I actually went into pediatrics only to do pediatric cardiology. I never thought I would be a pediatrician.
With February being American Heart Month, what are some of the new medical advancements that allow for early detection of heart defects in children?
So a secret to a cure in congenital heart disease, as well as in things like cancer, is early detection. So early detection is really important. Probably the one relatively high-tech development over the last X number of years has been fetal echocardiography. The ability to detect congenital heart disease before the babies are born. Now that can lead to a couple different things. One is it gives the obstetricians in the hospital a heads up that there may be a high-risk baby being born, so they can be better prepared and not wait for something to happen after the baby is born. And there is now fetal cardiac surgery being done that actually can correct or at least ameliorate some of the defects before the babies are born.
How do you view the global impact of foreign educated physicians?
We are dependent on international medical graduates. Two different scenarios. One is when they're in training. As we all know, during the GME activity, the trainees are caring for patients. And so we depend on those international graduates because they also make up 25% of the training programs to help care for patients. And then after finishing, for care of patients overall. The other statistic that's really important is that an international medical graduate is more likely to be practicing in an underserved area than a US graduate, and that's both rural as well as urban. And now that our population in the United States is so much more diverse, we know that patients can identify better with a doctor that is similar to them. So if we have a large number of patients that have come from, Latin countries, from India, a variety of different places, and they can have a caregiver with a similar background, it helps their care as well.